Well, again, as I want to be mindful of everybody's time, we do appreciate you joining us today. My name is Laureen Pryor, and I will serve as the moderator for this phone call. And we had like a couple, like 15 people signed up, so folks might come in, so you'll hear the ding dong. Just please keep talking. They can join in, and then we'll just kind of try to figure that out. I wanted to talk today about, the shelter in place, not the shelter, but we moved out of phase 2 into phase 3 pretty quickly. We want to know what that means for you. If you have any questions for Dr. Beilenson, he is here. If you had ever wondered anything, this is the guy you need to talk to. So without further ado, I'm going to turn it over to Dr. Beilenson, and he can kind of tell you about the guidelines, the stuff that has been put into place, what that means for you, and then we will go into a question and answer period. But following Dr. Beilenson, after he's finished, if we want to open it up for questions at that time, we can do that. Or we can just allow Elena to jump in and talk about how the state is planning to support what the county has already put into place. So if we want to do those two presentations first, and then we can take question and answers. For those of you who have questions, please be mindful, use the raise hand button so that I can see you, because we don't want to bombard everybody with questions. We want to do it decently and in order. So with that, Dr. Beilenson, I'll go ahead and turn it over to you.
Thank you very much. And it's a pleasure to be here back. I was at the restaurant. Was it the restaurant one last time? Yeah. So this is a little different. This is barbers and hairdressers and hair salons. And it's actually relatively simple what's being allowed. So as you probably know, we've now gone through the variance process where we're allowed to do what we want to do in terms of all of stage 2, which includes hairdressing and barber shops and salons, et cetera. So the guidelines are actually relatively simple, and they're kind of common sense. And remind me, Selena, to talk about the navigators before I forget. Anyway, it's social distancing as much as possible, although it's very understandable. This is a lot of face-to-face interaction. So we want people to wear masks who are both the clients as well as the store owners or the estheticians. So both sides wear masks. That means if you're cutting a gentleman's hair, then they cannot, you cannot do like beards and things like that, because you'll have to have a mask on. So there's a strict rule about mask on both sides of the table. Obviously, I'm sure you already do this, but with very good cleaning mechanics after you use the razors or whatever you use for the procedures. So make sure that they're very well cleaned, and social distance the people in your store, so that if you have a small store, people may have to wait outside or in their cars rather than conglomerate or congregate in the building. So that's really basically the guidelines. I'm sure I've forgotten some things, and you can obviously ask, but that's the guidelines. Let me just add a couple other quick things. One is that obviously compared to staying at home, there is an increased risk of the disease, no matter what you do, whether it's go to restaurants, whether it's go to a hair salon, whether it's going to church, even if it's a smaller church gathering than it would have been otherwise. There's a risk-benefit ratio here that we're having to deal with, and I think people have to be aware of that, so that as we open up the economy, it's going to be potentially an increased risk for the infections. So we are being very, very careful, at least at the health department. We have daily dashboards that look at all sorts of things, from hospitalizations to ICUs, to number of ventilators being used, to surge capacity, to number of cases, number of deaths, et cetera. And we're looking at that every day. I actually look at it 2 or 3 times a day to be particularly OCD about it. But the data is very important. And so what we've been watching is over a week or 2 week period, if the data looks like it's going back up, we may have to pull back a little bit. So I just want people to be aware that we're looking at the data real time and we're actually tracking it and making sure that things are not going off the rails. I think that's it. Let me give the navigator thing. Sorry, because Selena had done was very kind and wrote a letter of support. We have determined a couple of things. First of all, obviously, there's a huge amount of economic dislocation going on with what's gone on with COVID. And that's meant people have lost their jobs or have lost working hours or whatever. So in addition to, so we wanted to hire folks who were potentially out of work or had lost their jobs. And so we're hiring between 20 and 50 people for a combination of navigators and contact tracers, and I'll tell you what they are, and then I'll be quiet. Navigators are effectively to go into small businesses, predominantly minority-owned, but in general, small businesses, to help provide guidance as to how to safely reopen your store and to keep it safely reopened. So we've come up, and Selena kindly wrote a nice letter of support to the Board of Supervisors. That was funded with COVID money. So we have 23 or 24 staff and 2 supervisors paid better than livable wage jobs, which will be starting in the next couple of weeks. And they'll be going out to a variety of small businesses to work on giving education into how to open it safely and remain open safely. In other words, providing the guidance for like hair shops that I'm providing now, et cetera, but more detailed and better fashion. And then we will also hire contact tracers who will be going to talk either telephonically or in person to individuals who test positive to try and figure out who they've contacted with and be able to get them into treatment and get them tested and quarantined until a negative test determines that they can be released or vice versa. So those are the 2 groups that we're going to be hiring. We're going to be hiring again about a total of 40 or 50 people who will be in the jobs for about 4 or 5 months. And that will hopefully help to get some people through the economic dislocation until they can find a job again. And of course, provide important services for the community. So let me just stop there.
Well, thank you for that. And before Elena takes over, I wanted to ask you, you said something about if it starts to surge, you'll have to pull back. What does the pullback mean?
So the pullback means, it can be anything. It kind of sort of like first hired, first fired. No, last hired, last fired. It's not a great example, but so as we go further in, the ones that have been turned on may be the first ones to be turned off. I'm not saying we're going to turn off barbershops if things go off the rails, but people have to be aware that that's a possibility because obviously we don't want to have what happened in New York and Boston and Washington with an incredible devastation there. I think we were so lucky for a variety of reasons, as many of you know. We actually had the lowest case rate as well as one of the lowest death rates in the entire United States among major urban areas. So we've had very, very mild pandemic outbreak here. And we do not want to have a surge on capacity that they had in other places with the number of deaths and the number of ICU visits they had.
And do you guys expect a surge due to the protests that are happening right now?
I don't think so. Many people have, well, I mean, there's 2020 foresight, obviously. No one has 2020 foresight. It's conceivable, but it's outdoors and a lot of people are wearing masks. And so hopefully that will not be a major issue, but we will know about it in the next 2 weeks because the incubation period is 2 days to 14 days. So that's when it would show up.
Okay, got it. And I don't want to keep you on here if we don't have to. So is there anyone with a question for Dr. Beilenson right now? Since he's here, does anyone have a question? If not, we can move over to Elena. And I don't see a question.
I have a question.
Oh, Dr. Noble, go ahead, sir.
Hey, Dr. Beilenson, thanks for
Sure.
For your message. I had a question in regards to given the position that Black hair has within the Black community, both barbershops and hair salons. Is there any role in, have you guys looked at partnering with local sort of healthcare institutions to see about being able to not only get the message out, but also do some sort of preliminary testing? Let's say a patron comes to the barbershop and, you know, may have a fever or may have some of those isolated symptoms or may have some of those preliminary symptoms potentially of COVID. Is there any manner in which the barbershops or hair salons can communicate their local healthcare institution to see about that person getting tested? As we saw in Missouri, I believe, too, in that sort of situation, barbers are actually sick. But it does raise the question of, you know, because these guys have more contact with their clients than physicians have with their patients, could there be a relationship established with a local healthcare institution?
Yeah, excellent question. So these navigators that I was talking about, one of their jobs, which I've neglected to mention, is actually to helping people get tested and directing them to the sites of testing for COVID, both clients and servers, if you will. So that's absolutely a part of the navigator's purpose. And just so you know, I don't know how widespread this is. We've tried to get this out. We've used the Observer, we've used radio, etc. But we have community-based sites actually operating now that can serve people who are both symptomatic and asymptomatic. We have Robertson's Community Center, St. Paul's in Oak Park, La Familia. We're going to be in Meadowview, and we're going to be in Natomas. But we already have at least 3 sites going that are open at least a full day a week with phone signups. And so we're trying to get the information out about that. But we actually do have a fair amount of testing going on now as opposed to earlier on.
Great. And one more question. You know, my thought is that it's not going to be a matter of if, but a matter of when a barbershop or a hair salon may have a individual that comes to be positive down the road. Yeah. What are the situations in place as far as would that barbershop have to close if they find that, you know, they had a patron that had tested positive for coronavirus? And if so, what would be the procedures in place to say that they could reopen after they may have had a positive client and or a positive barber or a hairstylist within their shop?
So a barber or hairstylist would have to isolate themselves for 14 days. So that would obviously, I would imagine in most small businesses, shut it down for a couple of weeks. If a patient has it, they would be investigated by a contact tracer, which is one of the people I was talking about before, who would determine what kind of exposure the people actually had to other folks. And it may well be that if both were wearing masks, then all you would need to do if a client tested positive, you know, somehow, and both of you were wearing masks, and you were not symptomatic, if you're the barber or the hair salon owner, then you would be, you wouldn't have to quarantine, but you would be on symptom alert. So if you got symptoms, you get quarantined. So it differs. If it's a barber, my guess is it would probably be shut down the place for a couple of weeks. If it's a client, it would be an investigation to see how much exposure they had to the barber or the salon operator, and they may or may not have to quarantine. They may just be able to watch out for symptoms, but still be able to work.
Thank you.
And with, sorry. And
there's another question.
With the client situation, would the navigators then contact all the other clients that may have been there during that time?
So the contact tracer, the contact tracer / navigator will determine what, so they'll talk to Selena, let's say Selena tests positive and she goes to a salon, so she's a customer. Sorry, Selena. And our contact tracer would talk to her. It would be a part group of contact tracers, so they'd be culturally appropriate. They'd talk to Selena. They'd find out what she'd done, where she'd been the last several days, and if she says she's been at John's barber shop, then they would talk to John's barber shop and see if they actually were wearing masks all the time, or if someone really remembered coughing heavily on her or whatever. So it'll be up to the contact tracer in the bottom line.
Thank
you. Yep.
Thank you very much. Sorry, I need y'all to see me. Get it together over here. Thank you very much for your time, Dr. Beilenson. We don't want to keep you, and I don't see anyone with any more questions. So we will go over to Ms. Elena, and you tell us how the state is going to support what the county has already put into place. What is your role in here, in this?
Bye-bye, guys.
Thank you very much.
Hi, everyone, and thank you so much for having me here. Like we mentioned, so my name is Elena Santa Maria, and I'm a policy advisor for a nonprofit called NextGen Policy, and we are helping on the back end. Our former CEO, Tom Steyer, who helped fund who's our co-founder of our nonprofit, is now the head of the task force at the governor's task force on economic recovery, which is co-chaired by the governor's chief of staff, Ann O'Leary. And so just as NextGen Policy, we're a nonprofit organization, we work on the back end to help the task force work. And pretty much this task force was set up to bring business leaders together, different types of groups together, to come together and think about what California's economy will look like and what can we do to best support the economy as we shift into a world of COVID and what that means for everyday, for Californians. And so specifically, I help staff, you have the large task force, and then it's broken up into subcommittees. And the subcommittees range from immediate recovery, leveraging positive change, capital markets and infrastructure, workforce transition, economic equity, financial systems, innovation and progress, and small businesses. So that's a little bit of the work that the administration's doing, in addition to on the policy side of things and on the legislative side of things. The budget needs to be passed by June 15th. The legislature is moving very quickly right now to meet that deadline. You have to pass a balanced budget, and I heard that they came up with an agreement today in terms of what that budget includes. And so now it's a matter of just working with the administration to finalize that budget so he can sign it before the end of the month. Specifically as it relates to the task force, so the state puts out their guidelines. As the doctor mentioned, we're transitioning into stage 3, but a lot of the actual day-to-day, and I think what affects you all on the call here, is what the counties determine. And it seems like small business owners are having a hard time determining, well, if the state is saying this and our county is opening here, what does that actually mean for me? And so we've been hearing that feedback a lot. And so we're trying to work with the governor's office on business and economic development, GoBiz, to make sure that those guidelines are clear. So it's great to have calls like this, especially have a doctor. And at the end of the day, whatever the county decides, in a way supersedes the state, given how their COVID monitoring and tracking and systems and capacity are in place. But at the end of the day, the state determines whether or not that county can actually open the way that they want to, or dine the way they want to. So it'll be interesting to see, how like states or how counties are being impacted, and then what that means for the state level. As far as the support that the state of California is offering for small business owners, there's going to be $100 million for folks who do not qualify or did not get PPP, the federal loan program offered by SBA. And once the budget is finalized, the total should be $100 million of small business loan guarantee. It's a small business loan guarantee program. So pretty much you get the loan, and then the state will back the loan, and then you'll end up paying the loan. And the goal is to have it at a very low interest rate to make sure that small business owners can be able to afford the loan. But that is one of the ways that I think the state is trying to backfill what happened at the federal government in terms of being able to provide immediate assistance for small business owners. I think that's generally, if you all have any questions about the task force, I'm happy to answer them. If you have any like flags or hearing things on the ground of the day-to-day of like, we're struggling with this and don't understand. Oh, I'd also be remiss. So the government, the state also has these business centers, and it's under the governor's office of business and economic development. There's 83 in the state. Some of them are specifically geared towards community of colors, and they're the minority business owners or minority business centers. And then some are specific to women-owned businesses. And these are really centers that have reputable people that coordinate with the state to be able to answer your questions about how to get loans. Do you qualify? Where to find a lender? PPP, EIDL. I hear they're about a week in terms of scheduling an appointment, one-on-one consultation services, to be able to help navigate the loads of paperwork and everything that you need to be able to qualify these things. So I would be remiss if I didn't highlight those business centers for folks. I believe there's one in Sacramento, and then they're all across the state as well. So that's also another avenue for folks if you have questions about those loans or what it means for you, that's an access point as well.
And so is there a sense that there will be funds directed to specifically Black businesses who were not able to access those funds, being that, you know, when you read the data and you look at the newspaper articles, they were saying that Black businesses were basically locked out of those loan programs. So do you have a sense on whether the funding that we're talking about is going to be specific and directed to the people who were locked out, specifically Black businesses?
Yeah, unfortunately, I don't know if the small loan guarantee program allocates a certain amount of those funds to go to Black business owners. Definitely something I can follow up on to see if that would be like some sort of, whether it be, just allocation or percentage of. So it'd be an interesting question to pass along for sure.
And can you also ask, since we're talking about things to pass along, can you also ask about how is iBank going to be administering this program? Because I know that last year they gave out 529 loans and only 30 of those went to Black businesses. So do you know if they are going to be the point person for this particular program?
So iBank funds the guarantee, and it's the lenders that distribute the funds. So I think this is an access issue and a capital issue, and iBank specifically works with like credit unions and micro enterprises and the smaller folks, so not like your big banks. And so I think on one hand, you have folks who aren't applying for it or don't know that these funds are available, don't know that the business centers aren't accessible, don't know where to go. So I think I'm curious of the people who applied, how many, like what proportion of that, because I think that like communities of color I think they applied, but I think that's also an issue that makes that number so low. And it's so that iBank is a part of the program, and they do distribute it, and they're on the back end of distributing the funds.
Got you. And, you know, just so we're specific, I'm not asking about any other communities right at this moment. I'm asking specifically about Black businesses, because historically, and there's a history in California that Black businesses are left out. So I'm just curious as to what they are going to do to target directed resources. And if you can ask about that, I really appreciate it.
Will do, for sure.
Does anyone else have any more questions? Rob, you look like you're about to turn on your microphone. No? Okay. So,
I am.
Oh, you are? Okay, I'm like, did you hit the wrong button?
Yeah, I did. Sorry.
Go ahead.
So I'm sorry. Will these loans be forgiven? You said they were for the people that couldn't get the PPP loans. Will a percentage of these loans be forgiven like the PPP loans were?
No, they're just they're loans to be distributed, but they're not grants. Which is what PPP is. Yeah, they're not grants. They're loans at low interest rates.
Got it.
Mm-hmm.
Thank you. Thank you very, very much. If no one else has any more questions, we can go ahead and end it here. I want to thank you for your time, Elena. I want to thank you all who have joined us for this phone call and this information. This call will be downloaded to our website. So if you want to go back and review everything, if you missed the beginning of it, if you want to go back and review what we talked about, it will be available to you on BSBA's website under past events. So thank you, everybody. Have a great night and stay safe.
Thank you.
Of course.